what we're getting ready to cover is the basics of what it takes to win a case, how to put the case together, and this is like from the 30,000 foot view. This is the big picture, and this is what you need to be paying attention to, especially when you talk to the attorneys, and you got to be highly aware of this. So if you could write down the schematic, because you won't be able to see it as well here, but if you could write down the schematic. So on the left hand side going down, there's some categories that we need to pay attention to. So I'm gonna point out 8 categories is what I'm gonna point out, okay? So number 1 is mechanism of injury. Number 2 is injury magnifiers. Number 3 is subjective. Number 4 is hybrid evidence. Number 5 is objective evidence. Number 6 is complicating factors. Number 7 is the impairment. And number 8 is the prognosis and the ADLs, the pain and restrictions with ADLs. These 8 categories are categories that you're trying to fulfill within your documentation for the case. Now I'm talking about for their injury award. These are the documentation categories. And obviously these are major components of the 12 steps to tell the story, which would include your clinical components. But this is, if from the legal perspective, these are the most important 8 categories. Now some of these categories are more important than others, like injury magnifiers isn't going to be as important as the mechanism of injury. Complicating factors, and I'm just saying generally speaking, could there be an injury magnifier that's really important? Sure. I'm just talking generally speaking. Is complicating factors obviously is not going to be as important as objective findings, okay? But these categories is what we want to pay attention to. And by the way, this is what you need, the language you kind of know when you're talking to the attorneys, because they don't know this. So this is a very good document.